People commonly experience fear, restlessness, distraction, a clenched jaw, shortness of breath, and other symptoms that they associate with anxiety simultaneously, which can magnify their fear. One's anxiety level crosses a barrier when unique stressors will trigger disruptive physical symptoms in all patients. The formation of catastrophizing can cause anything from dizziness to sudden cardiac arrest, leaving you gasping for breath. The appearance of catastrophizing can cause anything from dizziness to sudden cardiac arrest, leaving you gasping for breath. But unwanted symptoms alone aren't the issue, Bullis says. But unwanted symptoms alone aren't the issue, some text goes here. Anxiety can be helpful under certain circumstances, spurring us, for example, to make sure we're prepared for that big presentation at work. In the right setting, it makes us feel invigorated, Bullis says. In the right setting, it makes us feel invigorated, some text goes here. Extreme physical sensations are, however, a direct result of the body's fight or flight response. These emotions can occur during a fight with danger, such as a home invasion. On bad days, a person may experience hypertension or feel like they have a heart attack. Dr. Arthur Barsky, a Harvard-affiliated Brigham and Women's Hospital psychiatrist, states that people with severe anxiety attacks commonly believe they will soon die. They see it as imminent physical pain and tribulation rather than anxiety, which will worsen their state of mind. It becomes a self-fulfilling prophecy. Apply for medical attention if you are experiencing chest pains or shortness of breath, as both could be due to a panic attack. Once you establish that anxiety and panic are the root cause of these symptoms, your next step is learning how to respond to episodes that trigger your panic button. Many people seek to avoid frightening circumstances and shy away from potential conflicts to keep them from increasing their anxiety levels. This is not the way to address problems with the anxiety level, suggests Harvard Medical Records. What path can you recommend for overcoming severe anxiety? Cognitive behavioral therapy, CBT, is often considered the gold standard and adequate. Bullis says people usually wait too long, even decades, before applying it and are astonished by how quickly they gain control over symptoms using CBT. The success rate is typically between 4 and 6 months. This strategy is known as CBT exposure therapy. You will experience unpleasant physical sensations during an activity that causes you to breathe more rapidly or become aroused. We are going to be dealing with things you have gotten good at avoiding, Bullis informs you. The more you practice it, the easier it is to handle. Just as with a vaccine, repeatedly and deliberately exposing yourself to these terrifying sensations reduces the impact they have on your life in the real one. Situational stress medications, including beta blockers or benzodiazepines, may be helpful for short-lived anxiety to alleviate agitation. But a variety of drugs like this can perpetuate the belief that sensations are dangerous, reinforcing dependence on medication. Matthew, cancer and stroke survivor, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.